Hi, my name is Maddie, and I'm going to be talking about the ELIZA test and how that relates to today's life. So ELIZA just stands for the enzyme-linked amino assay. And in summary, it's an antibody test that uses solid phase type of enzyme to detect the presence of a ligand in a liquid sample using antibodies directed against the protein to be measured. The types of liquid samples that are used include plasma, serum, cell culture, saliva, and urine, but a lot of other bodily fluids can also be used. The four types of ELIZA include direct ELIZA, indirect, sandwich, and competitive. In direct ELIZA, the procedure includes adding the samples to the wells, coding the wells by the sample protein, using a conjugated detection antibody which binds to the immobilized sample, and then a color reaction corresponds to whether the antibody was present. In indirect, wells are coded with the antigen first, and then the antibody in question is added. The enzyme conjugated secondary antibody binds to the antigen antibody complex, and then the substrate is added, and an enzyme color reaction responds to whether the antibody was present or not. In sandwich ELIZA, the wells are pre-coated with the capture antibody. The sample is added to the well, and antibody in question is bound by the capture antibody. The conjugated detection antibody binds to the immobilized antibody in question, and then direct detection and enzymatic color reaction corresponds to the bound antibody. Finally, for competitive ELIZA, the wells are pre-coated with the secondary capture antibody, and then the capture antibody, conjugate, and sample are all added at the same time, and the analyte and conjugate compete for binding, and then there is a color reaction corresponding to whether that conjugate was bound or not. Some advantages to ELIZA test from NCBI include that it is a simple procedure, there is high specificity and sensitivity due to the fact that a specific antigen binds to a specific antibody. There is high efficiency, and it is safe and eco-friendly to use in labs, and it is also cost efficient for labs. Some disadvantages include that preparing the antibody is labor intensive and expensive for labs, and it also requires sophisticated techniques and expensive culture. There is a high possibility of false positive and negative, which is commonly heard in today's lingo as COVID-19 is very common, and I'll get to that in a second. And the antibody could be unstable that is prepared in lab. And finally, the antibody needs to be transported and stored, and it has to be stored in a refrigerator. So transporting it and storing it is difficult. So as I mentioned, ELIZA and COVID-19 are corresponding. And they relate in that if you have had COVID-19 or you think you've had it, you can get an ELIZA test to test for antibodies. And the specific ELIZA test used is an indirect ELIZA test, and it tests for specifically IgG and IgM antibodies. IgM antibodies are the first antibodies produced by the immune system in response to a foreign invader in the body. And this just indicates that you may still be infected or you just recently recovered from COVID-19. IgG antibodies remain in the blood long after the infection has passed. It is unsure how long after for COVID-19, but it indicates that you have had COVID-19 in the recent past and you may have antibodies that may prevent you from future infection. And specifically with COVID-19, indirect ELIZA has been used to diagnose patients who are more than a week post-symptomatic, and it determines potential immunity and risk of infection, and it also helps advance contact tracing on a larger scope and immunity in communities. Here's a supplemental video about COVID-19 and just how IgM and IgD relate to coronavirus in serology testing, which does not detect the presence of the virus, but rather the antibodies that were there.
Currently, there are two types of tests for SARS-CoV-2, which provide different kinds of information. Diagnostic tests tell us if someone is currently infected. Antibody tests, also known as serology tests, tell us if an individual was infected in the past and has had an immune response. Serology testing does not detect the presence of the virus, but rather detects the antibodies that are or were produced by the body in fighting the disease. Antibodies are proteins produced by the immune system in response to an infection and are specific to that particular infection. They are found in the liquid part of the blood called serum or plasma. Immunoglobulin M or IgM is the first type of antibody produced in response to an infection and is detectable 4 to 7 days after an infection starts. IgM antibodies are short-lived, and their existence signals a new infection is present. Immunoglobulin G or IgG antibodies are produced 7 to 14 days after infection. These antibodies can be detectable for weeks, months, and even years depending on the antigen and the individual. IgG antibodies are usually sustained for a longer time and may play a role in lasting immunity. However, since we don't know a lot about SARS-CoV-2, as it's a new virus, we don't know how immunity against this virus works. Total assays, which are combined IgG-IgM tests, cannot distinguish between early IgM and late IgG antibody responses. As a result, total assays can't reveal whether a person has the IgG antibodies that are needed for longer-term immunity or if they are currently infected. For clinicians, knowing whether an individual has developed SARS-CoV-2 specific IgG antibodies could be critical to determining immunity. An IgG-specific serology test reveals if someone had COVID-19 in the past and as a result has developed antibodies that are specific to this virus. The right type of serology test could help us understand immunity against COVID-19 at an individual and population level. This can be a key tool to help us develop plans to reopen society.
So obviously, there are some huge advantages, but also disadvantages to using ELIZA for COVID-19. Obviously, any sort of help to help understand this virus is welcomed, but the type of antibody not being able to be detected, whether it's IgG or IgM, and also not knowing how immune someone can stay from this virus is not super helpful. But I know that it is important if you have antibodies to try and donate blood and donate antibodies to labs so they can test them, and also to just take the ELIZA test if you think you've had COVID-19 or you have it, just to protect others from possibly getting it. I know I hate bringing up COVID-19, but the spread can be stopped through ELIZA testing, and that is great. And just staying positive and helping out as needed, donating blood, taking ELIZA tests, and listening to all of the new information about immunity will help possibly end this pandemic and get our society back on track.